Chairman and committee members, thank you so much for the opportunity to speak on behalf of 110,000 registered nurses in the Commonwealth. Let me share a few facts with you. The Virginia Department of Health currently, as of yesterday, reported 20,380 COVID-19 cases among healthcare workers. Out of that number, only 230 have been able to successfully prove they contracted COVID-19 on the job and were awarded workers' comp benefits. That's just slightly more than 1%. The current system is not working. We know through CDC data and other published studies that healthcare professionals are at least 3 times more likely to contract COVID on the job than in their communities, because of the level of risk associated with cumulative exposure during the course of caring for COVID patients. Arguably, nurses are at the greatest risk because they spend more face-to-face time with patients than other healthcare providers. There's a reason that healthcare providers are being prioritized for the COVID vaccines, and that is that the public and the national and local policy leaders recognize the tremendous risk healthcare providers face in working with patients who have COVID day after day, as well as the risk to the general public when healthcare providers are unable to work because of COVID infection. And while we anticipate the vaccine will protect many healthcare providers in the future, at a 94 to 95% efficacy rate, it will not protect all healthcare providers or those who are unable to take the vaccine because of certain health conditions. As of December, 17 states have taken action to extend workers' comp coverage to include COVID-19 as a work-related illness, and many more are taking up similar proposals in legislatures that convene in 2021. We believe that Virginia's healthcare providers are at least as entitled to a workers' comp presumption as those in other states. We've sought to narrow HB 1985 by providing start and stop dates for COVID-related workers' comp coverage. The start date of March 12th, 2020, when the governor first declared a public health emergency, through December of 2021. That's this December. We've also limited the workers' comp presumption to those healthcare providers who only work directly with COVID patients. Let me add very quickly, and I'll finish, the voice of 2 registered nurses in Virginia who've contracted COVID-19 on the job. And I quote, "A month after contracting the virus, I'm still fighting pneumonia and other serious complications related to COVID-19. I have medical bills piling up and no idea when I will physically be strong enough to return to work. Workers' comp would cover my medical expenses and lost wages. Yet under the current laws, I cannot claim it without proving a direct link to a specific positive patient. I ask that those of us who have bravely served the Commonwealth during this scary and vulnerable time be cared for during our time of personal need." And one more very quickly. "I'm a registered nurse working on the front lines of this pandemic. I did contract COVID-19 earlier this year as a result of caring for COVID patients at the bedside in an acute hospital setting. I was out of work from April 2nd to August 2nd as a result of my illness and recovery. I was only compensated for the first 2 weeks, which has been financially devastating for me and my family, and workers' compensation would have helped us significantly." And in closing, I just wanted to inform you that this afternoon at 5:30, the Biden Inaugural Committee is going to hold a memorial to honor those nurses who have lost their lives to COVID-19. We humbly ask you to honor all nurses and healthcare providers who've dedicated their lives to the well-being of all Virginians. Thank you so much.
Thank you.